Hello, my name is Igor Ramos. I'm a physician and professor at the Department of Public Health at the University of Guadalajara in Mexico. Recently, with Rigoberto Cisneros, we published the article Salutogenesis in Mexico and Latin America, a protocol for scoping review in JMIR publications, specifically at the research protocols. In our article, Salutogenesis in Mexico and Latin America, a protocol for scoping review, we explored a profound shift in how we understand health. Traditionally, health systems have focused on one main question: why do people get sick? This is known as the pathogenic approach, which focuses on diseases, risks, and treatments. However, our research asks a different and powerful question: why are some people able to remain healthy even under difficult circumstances? This is where the concept of salutogenesis comes in. Developed by medical sociologist Aaron Antonovsky, this model proposes that health is not simply the absence of disease, but rather a dynamic continuum in which people can move toward well being, even while facing stress, chronic illness, poverty, or inequality. At the core of this model is the concept of sense of coherence, which refers to a person's ability to understand what is happening in their lives, manage challenges effectively, and find meaning in those experiences. Our study aims to conduct a scoping review to systematically map the scientific evidence on salutogenesis in Mexico and Latin America, published between 2010 and 2026. We want to answer questions such as: how is salutogenesis being studied in our region? Which populations have been investigated? What instruments are being used to measure sense of coherence? And perhaps most importantly, how is this model adapted to the cultural, social, and economic realities of Latin America? This is especially important because Latin America faces profound structural inequalities, violence, chronic diseases, and multiple social challenges. Yet, despite these adversities, many communities demonstrate extraordinary resilience and ways of building health and well being. We believe that understanding these processes can help transform healthcare systems, moving from a model focused exclusively on disease toward one that also strengthens people's health assets, capabilities, and community resources. In practical terms, this work may contribute to design of culturally congruent interventions, stronger health promotion strategies, and public policies more focused on well-being. We chose to submit our research to JMIR publications because it is an internationally recognized publisher known for its scientific rigor and leadership in health, digital health, and interdisciplinary research. Additionally, JMIR research protocols was especially appropriate for our work because it provides an excellent platform for publishing rigorous research protocols before final results are available, promoting scientific transparency, methodological reproducibility, and international collaboration. We also felt that this journal global and innovative perspective aligned perfectly with our goal of positioning Latin America salutogenesis research within the broader international scientific conversation. Publishing in JMIR represents an important opportunity to highlight how Mexico and Latin America build health in contexts shaped by diversity, inequality, and resilience, contributing new perspectives to the global field of health promotion. Thank you very much for listening.